She won most talkative in high school, and she has been running her mouth ever since. Welcome to the Lisa Fisher Said podcast with your host, Lisa Fisher.
Okay, this is what you do when you've got the experts on with you. You ask all the questions. I love your social media account because you, no holds barred, you tell it like it is. Tell me, it's crazy that I'm asking a medical doctor this, but how did you get involved in the health aspect? And, because you would think physicians are about good health, but they're not as much anymore. You have an interest that really, probably, I bet, changed the trajectory of your practice. So tell me about it.
Sure did. So, I think when you talk to most of us who've gone from, conventional medicine to more holistic medicine, we always have our story. So mine was really, my son was the catalyst for getting me into it. And then, of course, it changed my own health too. But my youngest is on the autism spectrum. And so we had taken him everywhere you can imagine. And it took a long time to get a diagnosis that he was on the autism spectrum. And then finally, when we did get that diagnosis, we were told there's not a lot we can do for you. We can give you a medication to calm him down, and you can take him to some therapy, some occupational therapy. So the occupational therapy was a humongous disaster because he would roll on the floor and scream when he went to occupational therapy. And the medication that they wanted to give him was something that you have to do an EKG for on a 6-year-old because it can cause arrhythmias. And so I just thought, no, I need to look for other ways of doing something with this. So, because I asked, is this going to change his neurologic trajectory? And they said, no, he's always going to be like this, and this might calm him down. So I was like, no, I'm not doing that. So I started reading, and I first started him on fish oil, first on one brand that didn't really do much, and then I went to a physician brand, and it really immediately calmed him down within a few days of taking this fish oil. And I'm not saying this is the cure-all for autism. Yeah. This is just what worked for my son.
Yeah.
And then I just happened to get invited to this meeting with the Dan Doctors of Autism. And I don't know why they heard about me. I think they heard about me because I was looking for nutrition reps that had fish oil that I could use, from physician-branded companies. And so they invited me to this, and I was like, wow, they're treating this with diet. So I just immediately, I had muscle aches and joint pain, could barely get out of bed. I was basically struggling to work, even though I had my private practice and I was handling the ICU of a small town kind of by myself in my early 30s. But I was struggling to get out of bed in the mornings, and I had a friend who was a naturopath who was like, you should really get off wheat and dairy and quit drinking so much coffee and Diet Coke. And I was like, I don't have time for that. I have to keep going all the time. Well, because of my son, I did all those changes because he had to go on this diet. And lo and behold, he got a lot better. He also started an antioxidant that a friend of mine who's an orthopedic surgeon who was giving it to his kids told me, try this for his allergies, because everything we gave him med-wise for his allergies made him worse. And he basically went, from 3 months from not recognizing letters to reading recipes, because he's really into food.
Wow.
And he makes beautiful food now as a 3-year-old. So, the change in his health from all these lifestyle interventions really convinced me. And plus, when I went on his diet, I quit having all the muscle aches all the time that, kept me down all the time. And I didn't have to drink 3 espressos and 12 Diet Cokes to keep myself going all day. And so I was like, wow, there's really something to this, medicine. And it wasn't that I didn't have respect for holistic medicine, because I come from a long line of doctors. My ancestors were, Jewish doctors who had practiced for thousands of years in the Middle East. They were even physicians to the Persian court. And they didn't have Merck or Pfizer or any of these drug companies there. They were just using holistic medicine, and they were these religious minorities who survived in the Persian Empire because of their knowledge. So I had some respect for that, but it was this really brought it home to me, you can really change someone's trajectory with lifestyle. And that's why I started taking a look at my own health, because I was 100 pounds overweight, and nothing in the conventional world was helping me. So yeah, that's where it all started.
So was that, you said he's 23 now, so about 16 years ago or so, let's say 2005 or 6. Did people think you were crazy? Because you were an early adopter to kind of what now that, this is one thing I like about social media. It can change your life in a good way. It can also weight you down in a bad way, right?
Sure.
Because it's divisive, it's a lie, and all that. But when people are here to tell the truth about what happened in their lives, then we can embrace it. But you are talking about this, Dr. Emi, before kind of anybody else was. So
yeah, it was the early 2000s back then.
Okay,
So,
now we run to the internet or somebody's Instagram account. What were you looking up?
So I started looking at basic science studies, looking at like fish oil and expectant moms. And right before I got pregnant, I actually went on this diet from one of these national diet companies, and they were using Olestra and all these like horrible kind of fake fats that, rob you of your omega-3s. So I was like, wow, I probably just robbed my child of omega-3s while I was pregnant. This is crazy. And my first child was like, a genius, like 6 going on 20. And he had been born while I was doing a missionary year in Japan. And I was eating like, fatty fish every day from like Hokkaido. It was before the nuclear disaster, so everything was very clean. And, I just kind of took a look at that and I was like, these are my 2 kids and look at how differently things turned out with my lifestyle. And people, do these crazy things to try to lose weight, unfortunately. And that was the crazy thing I had done before I got pregnant. So I looked at the basic science studies and I looked at, this antioxidant that my friend recommended. And I was like, wow, they're using this antioxidant in Europe with kids on the autism spectrum. And there were studies on it and everything. And it was never presented to me, as, change his lifestyle or try supplements or anything like that when we were taking him from doctor to doctor to doctor. So that's where I went. I went to basic science. And my attitude was like, if it's not harmful, I'm going to try it. So that was kind of, if it had safety studies, I was going to try it.
What does he have to do now to maintain good health for him? Still stay between the white lines and not have this or not have that? Okay, good.
And that's the great thing about people on the autism spectrum. They don't have trouble staying within the white lines. So, so he basically, still follows a diet. I've really encouraged him to actually have a cooking channel for other kids on the autism spectrum because he's so amazing. Like his presentations are out of this world, crazy, beautiful. And he's like, no, Mom, I'm a fisheries biologist. That's what I'm doing.
Oh, okay.
But he's an amazing cook. He takes all his supplements still very religiously. When he's home, he actually makes my supplement piles for me to take.
I love it.
It's been a huge health transformation for our entire family. But he was really the catalyst because if it hadn't been for him, I probably would have just kept going, how I was.
Now, how did you feel about being an overweight physician? Did you feel like, I'm not a good representation of good health, or did you think everybody's fat because we're all eating donuts from the break room that the Pfizer rep dropped off the beautiful lunch and blah, blah, blah. Did you justify it?
And it was the Pfizer rep. Well, yeah.
Right.
So, they're going to come after me, I'm sure. But anyway, it was, I think if you've watched my videos, you've kind of seen me tell the story. But, I was 100 pounds overweight and I was trying to do lifestyle things because I had changed my lifestyle and I felt a lot better, but I was still horrendously overweight, like 100 pounds overweight. And, so I had a patient that turned to me and said, you're like 100 pounds overweight and you're giving me lifestyle advice. She was a diabetic and I was haranguing her about.
Ouch. She said something to you.
She did. She was one of those smart aleck people. But,
I
she
love
was
her.
right. I have to take a look at what she was saying and go like, hey, she's right. And I didn't have any solutions at the time because there were none. Like I'd even seen doctors that dealt with obesity and, they were like, oh, go on metformin. Well, it made me deathly ill. Like it didn't really help me at all. And I was pre-diabetic. It was scary because to be a diabetic, your blood sugar fasting has to be 126. Mine was 124. I had a hemoglobin A1C with 3 month sugar test of 5.8. So 5-year risk of full-blown diabetes at 80% with that. My insulin resistance score was through the roof. I think it was 67 at the time.
What was your fasting insulin, or did you know it then?
It was 18.
Your fasting insulin was 18. Oh, yeah. Okay.
So everything was on that proposed path to
Right.
diabetes. I have a very strong family history of that, so I could just see it. I was working in the ICU admitting diabetic patients who'd had limbs chopped off or were on dialysis, and I was like, oh my gosh, this is what's in my history. So I started starving myself, like eating 1,200 calories a day, pushing myself up a mountain, basically 4 days a week. We have little mountains where I live in Enumclaw, Washington. So there's this place called Mount Peak, which is a steep, 1 mile climb. And I started doing that. And I lost like a total of 5 pounds.
Right.
It's just like very discouraging.
Right. I know. I was there. I got you.
Yeah.
And so who lifted the blinders for you to understand that insulin, though we have to have it, can be our enemy sometimes, two-edged sword or whatever they call that.
Yeah.
What was it then that you started realizing calories in, calories out is not sustainable?
Yeah, and the thing is, a lot of people starve on these diets, and I feel so sorry for them because they're getting this wrong advice. And, the fact is that your metabolism will slow down
Oh, for sure.
meet this calories in, calories out, or all these dumb diets we followed from the 70s would have worked for all of us, right? So the same friend of mine who's an orthopedic surgeon who gave me the antioxidant for my son started doing weight loss classes. He has a master's in public health as well as being an orthopedic surgeon, so he's very,
Wow.
different.
Yeah.
He started doing weight loss classes because he knew that for every, pound that you lose, you take 4 pounds off your joints. And he just thought, like, if I can get these people to lose some weight and actual fat weight before they go through surgery and build some muscle, then my surgical outcomes are going to be so much better than everyone else's. And he was so right. And he was able to get people to do like partial knee replacements because now they were thin enough that wasn't going to like pop out of their knee. And so he started doing this class, and as part of this class, they had like a supplement that had CLA and chromium in it. And it's a chromium that I don't particularly like. It's chromium picolinate, which can be hard on the kidneys. I happen to not have any kidney damage, but a lot of people by the time they're as close to diabetes as I am. But it was eye-opening because when I took the supplement, I didn't have sugar cravings anymore, and I was happy not eating a whole lot, and I could eat, the right diet. And the diet was also a low glycemic diet, so it didn't count calories at all. It was just concentrating on, is this food going to spike your blood sugar or not? And all of a sudden, I lost down from 235 pounds to 150 pounds. And when the rep came in with the donuts, I kicked her out of my office, which normally I've been like, give me the donuts, I want to eat them, I can't stop. And then go back to 1,200 calories the next day after I'd messed up, once a month that badly. But, when she came, I was like, I have people with diabetes and pre-diabetes in my office, and I really don't want these in my office. I want to be a good example.
Good for you.
But it was the supplement that really helped that. So I was like, wow, I couldn't tolerate metformin, but I can tolerate the supplement. And since then, of course, there's a lot better that's come out, and I understand a lot more about herbs and things for helping people, maintain stable blood sugar. But at the time, it was like, wow, something does help that. And that was really, and then the other supplement I took was one that really helped your adrenal. So it, helped to boost, DHEA production so that you didn't spike cortisol quite so much. So that was the other one I took, and I was still massively under stress. I was, somebody in their 30s, still, largely working in this small community hospital by myself, kind of straight out of residency. And, so that also really helped. And I was like, wow, there's something to this cortisol picture. And that also brought home to me that there's probably more than one thing that, is really getting most people to not be able to lose weight.
Were you practicing emergency room medicine, or were you in a family practice?
So I had a private practice internal medicine.
Okay.
I was kind of moving more towards diet and lifestyle, but I hadn't had functional medicine training at the time. But I also had been brought to this town by the small community hospital that had a small ICU. And I had a lot of ICU training. Most of the other docs in town did not. So if somebody ended up really crashing and they couldn't, our town, when it snows and ices sometimes, we're south of Seattle near the mountains, people can't get out of town because all the roads are closed and it can be a storm and you can't help, vac people out of there. And so if somebody ended up critical, then I had to go in no matter what time or what was going on.
Right.
I always had a vehicle that could get through the snow and stuff. And so that was kind of my life. And if somebody was really ill and came to the hospital, even if they had another doc, they would kind of call me and say hey, it was before the hospitalists took over in hospitals. So doctors were admitting their own patients back then in the early 2000s.
Did you give yourself permission to grieve the dream of your son's diagnosis, though I know it may not have hampered him, but for a mom who is as driven as you are, that had the first son that was reading Latin by the time he was 4,
Yeah.
We forget, and you know this, and I know this, but, I'm 100 years old, so I know it, but the cortisol that we push out from the highs and lows of life affect us from our chin to our toes. And we wonder then, the mom who's a friend of mine whose husband dropped dead, she wonders why she gained 20 pounds after that. She goes, I promise you I wasn't sitting around eating. I said, I believe you.
Yeah.
So do you think part of that weight gain was also during the time you were getting adjusted with him and what was going, because it's a transition for you?
Oh yeah. I mean, I really feel for moms, and that's why I mostly actually work with people in menopause because
Good.
I think I almost have like PTSD about that mom phase because you really can't live for yourself. And I have a bimodal story. Like I actually gained most of this weight back being an ICU doc at night because I then took a job as a night ICU doc. And that was near menopause. So I actually had to that's when I actually figured out like neutro-genomics and hormonal triggers and all that, because it wasn't like your 30s where you just go on a couple supplements and your weight drops.
Right.
But yeah, I really feel for moms because they really can't live for themselves. And I remember like just staying up late at night so I could just do something that I wanted to do. Which, now in my 50s with grown kids, I can do what I want. But back then I really couldn't, and I had college bills that were going to come and all that. So you have all those stressors of being a mom, not only raising them, but planning for their futures, which, that's kind of the nice thing about being our age is now you can kind of live for yourself a little bit. So
I'll tell you, if you have gotten to the empty nesting phase, my husband said the other day, 35 years for us, so we've been married, and he said the fun thing about empty nesting is it's like dating, but you have money. Because remember, we were dating, you had to go where there was the 2-for-1 special at Pizza Hut.
Exactly, right.
And now we get to hop in the car and do what we want and have that flexibility, which is a sweet time. It's a reward for the hard work of raising those kids, of staying married, of... they're just hard times for moms. That's all. I mean, we're lucky because you and I have long-lasting marriages. But yes.
Part of what I'm dealing with the people that I work with is they're actually on the market at our age, and
I hate that. Oh, bless their hearts.
So we have to kind of get things to where they can feel good about that.
That's right. Well, and also people who are married. That's the other thing. We want to encourage them to in order to stay married. You're going to feel good.
Have that fire in their marriage
yes.
and be able to sustain, that intimacy and all
yes.
that. Definitely.
Well, let's talk one thing about what you eat, because I also have Jewish roots. My father was a Russian Jew. And so are both your parents Jewish?
No. So my mom is actually from a tribe in the Middle East called the Lors.
Oh, wow.
They're kind of like Native Americans of Persia. So they predated the actual Persians, and they were kind of pushed more and more into their little area. And so they look very different. They look sort of Scandinavian almost, my mom's tribe does. Yeah, and they're horse people and nomadic herders, and they have a very warrior-like culture, and women are equal in their tribe. So when they compete for who's the best warrior, the best competition is actually amongst the women. So it's a very interesting tribe. Yeah,
I love it.
My dad's
okay, so let's talk about then food preferences. Do they root in your Middle Eastern roots? I mean, are they? Do you feel like you know what I mean? Do you think, gosh, I would take a falafel right now, or some hummus, or tabbouleh? I would. Yeah. Or do you crave more I try to eat more of a carnivore diet, and I miss some of my Jewish, Russian Jewish foods that I go, oh, I want some borscht soup. So is that normal for us to love what our ancestors ate?
Yeah, and I think there's some good in the ancestral diet. So for my mom's people, they were basically nomadic herders, and so I actually do super well with lamb and all those kinds of meats as long as they're grass-fed organic. Yeah. But I do, so Persians eat a little bit differently than the rest of the Middle East. So we don't eat the same as Lebanon and Israel and Syria, where they have the falafel and the hummus and stuff. Our food's a little bit different. It's more like mild Indian food, I guess. Okay. It's more herbal, but it's stews and rice. So I've kind of adopted the stew part of the Persian diet, but not the rice part. I can't really do the rice part. And if I do rice, I'll do wild rice once in a while. But yeah, I do think there's something genetic in the way that we, eat and can eat. And I know for me, for instance, the first time I started having dairy allergies is when I left home, because my mom always made organic yogurt. She's a nutritionist. She knew about, organic. She had organic milk. She would make her own yogurt at home. Wow. And the only dairy that I ate growing up pretty much was her organic yogurt. And then lo and behold, I go to college, start, all American yogurts basically, except for one, which is White Mountain. All of them have added non-fat milk solids, so you're not really getting a fermented product anymore. So the first time I actually started having dairy allergies is when I ate what most people eat, normal dairy. And so, I do believe in some ancestral component to the diet, and the neutro-genomics actually has proven that to me over and over again, that, we're all different in what we should eat. We can't all eat the same diet.
Right. So, I totally agree with that. And I see that here in my own home with children in and out and preferences and diets and things like that.
Yeah.
So I was wondering then, were her yogurt, I wonder if she used goat milk or anything non-traditional then.
So she used organic Jersey cow milk, which is, the A2.
Yes.
That's what she was using. So, which is closer to like goat and sheep than the Holstein cows that we now all eat.
Yeah, less inflammatory for sure.
Less inflammatory, right. And that's why a lot of people, when they come from other countries, they all of a sudden have dairy allergies because they're switching from Jersey cows to Holstein sort of thing.
Is your thyroid a working member of your body?
No, well, it's better. Okay. I started to have Hashimoto's kind of right when I gained the weight the second time. Huh. And that's when I really had to take a look, because my normal thyroid testing looked normal. And I was, hearing about Hashimoto's. I had an endocrinologist in my area that was like treating it. And I started reading more and more about Hashimoto's and how your thyroid gland doesn't really work. So at that time I wasn't fully functional medicine, but I knew like people who have Hashimoto's, their thyroid doesn't really work. So I ran the antibody. It was really high. My TSH was, like 3.5 or 3.8 or something like that. And, I was like, well, it's not working well. I was reading about menstruating women and how the TSH of 2.5 is really what endocrinologists want, but they've sort of come to this agreement that they're going to accept a TSH up to 4 because they don't want to have everybody be on thyroid medication.
But why not, if it makes us feel better? I've never understood that philosophy. They ought to put it in the water.
It's based on like world public health norms and, trying to not overburden healthcare systems, I guess. That's kind of, but it doesn't really serve the individual. I mean, if you're that individual, and I think it's sort of short-sighted, because if you're hypothyroid and your cholesterol goes up and you gain weight, then what kind of a burden are you going to be on the healthcare system then,
Thank you. That is the best way to argue that.
Yeah, but I mean, that's kind of how they've argued it as well. We don't see a big difference, in public health numbers if we treat under 4, so we're just going to agree that's where it's going to be. But there's a lot of evidence at 2.5 for women, perimenopause, menopause, early menopause, and menstruating, that's really where TSH should be, which is inversely proportional. It's high when your thyroid is actually low. Right. So bringing that number down actually means we're treating you at, an earlier stage of thyroid. So I looked at that and I was like, I should really go on thyroid. Well, I went on Synthroid and I did horribly. But then I learned more about thyroid again. And I checked T3 and I was like, oh, my T3 is really terrible. So then I started taking something with T3 in it. But as time went on and I really learned more and more about functional medicine, I learned how much an autoimmune disease like Hashimoto's can be related to your gut health and general inflammation. I learned that, if you're not making T3, a lot of times it's because inflammation is going on in your body or your liver's not working properly and you're not able to convert T4 to T3. So now I do take a minimal amount of thyroid because of all those years I had undiagnosed Hashimoto's and burned out my thyroid. And so
for sure.
It's not possible to reverse everyone, but I think if you catch people early, it is reversible. And there's a lot of doctors who are very conventional going on TikTok and Instagram saying, well, it's never reversible. And that's not true. We're all individuals. And for some people, if you catch it early, it's reversible. And even Hashimoto's, and sometimes it just resolves on its own, in 10% of people because it's brought on by a virus and their body like handles that and they do okay. For me, I think I had gone years and years before I actually was clueful to it. And so I still am on a small amount of thyroid, but much less. much
Right.
less. And I've, done things to help, reduce my estrogen burden, and, really help to, because if your estrogens are high, you can't really convert T4, the kind of thyroid your thyroid makes, to T3, the kind of thyroid that your body uses. So, reducing that extra estrogen burden, making sure that I'm not bringing, xenoestrogens from the environment into my body and all of that have really helped me. And the article that some people have seen on First for Women magazine that kind of talked about this and my journey, that's kind of where, I kind of feel like for some people it can be reversible if it's caught early enough.
Yeah. My story is that's what got me interested in health was about 20 years ago. I was constipated, cold, hair was falling out, a loss of eyebrows, vitiligo. Now my vitiligo was small, but that's usually a component, as we know, hand in hand
Absolutely.
with right. But I couldn't get anyone to listen to me because they said, "Well, your TSH is 3.8. You're fine." Pat me on the leg. And finally, I did have an endocrinologist with whom I broke up because he wouldn't let me take a complete thyroid replacement. And by then, I'd done my PhD dissertation. I'd done all the studying. And he just kept me on Synthroid, which I call a Tic Tac. But my antibodies were at one time 2,400. And now, since I've been eating carnivore and I've been intermittent fasting for 6 years, they are 38. So I look like I've reversed the autoimmune side of mine. But like you, my little gland died during all those years of being beat to hell by itself. So I'm fine with that. I don't care because, I'm not on a drug. I'm on a replacement hormone.
Yeah.
So what? If that's the only thing I take, so what?
Yeah.
So,
I'm interested too because I recently signed up for MediShare because I quit working as an ICU doc and I lost my insurance.
Good. Mm-hmm.
And they actually don't count hypothyroidism as a disease. They kind of let you, get tested and get on thyroid hormone of your choice. And I thought that was very interesting.
I love that.
Yeah. So
I feel that way also about my bioidentical hormone replacement therapy.
Sure.
I feel like I'm not on a drug. I'm on, I don't. So, I don't go anywhere where I fill out a piece of paper. But if I did, I always think, if I'm ever questioned, I don't feel like I'm on a drug. I don't take drugs. I take, hormone replacement therapy in order to be upright. If you want me to be upright and delightful, you better give me my estradiol pellet, here's my testosterone transdermal, and my progesterone every night. And I sleep beautifully. So let's talk about this. Gosh, I see it every time on TikTok, everywhere I go, every social media platform. Perlmutter talked about it today in his post, and it's the peptides and the weight loss with Ozempic and semaglutide. What is your feeling about it?
Well,
you're
It
sighing.
can work for some people, and it is a very quick fix.
Yes.
And I've had patients who see these people, and they're kind of like, "Oh, they look so great." And my question is like, "Did you pull up their shirt and look at their abs?" Because the thing is that when you lose weight, you want to be able to lose it in a way that actually leaves you with a beautiful physique. And when you lose weight too quickly, you're not going to have a beautiful physique because you're going to just have hanging chads everywhere if you're anywhere over 35.
Yes,
one.
hanging chads, yes.
And number two, you want to fix the problems that have gotten you to where you are. So if you are counting on a medication for, getting you to your weight, what's going to happen the minute you stop that medication, that very expensive medication? There it goes. And so it's a double-edged sword because it's hard to watch people struggle. But on the other hand, there is no free lunch. And so, for me, the second time that I lost weight, it really took months of cleaning up my gut, my diet. And this time it was permanent, and it gave me a physique that, some of you who've seen my videos, I wear like my, I show my six-pack abs and stuff. Well, I wouldn't have that had I lost weight a different way, which wasn't like cleaning up my diet or, getting my gut health to where it should have been or taking the right vitamins for my genetics. Those things take time. It's not going to be the 10, 20 pound weight loss in a month, but it's going to be something that gives you like long lasting dividends in your health. And it's going to be different than, just taking a drug that's going to drop weight really quickly. The other thing that has to go along with whatever you do from a biochemical standpoint is the exercise. You have to find the right exercise for you. Are you an ACE-DD genotype? Are you a person that needs to really do a lot of reps and not a lot of weight? Or are you an ACE-I where you're going to have trouble building muscle and you need heavier weights? So that's the other component of it that the people that just use, medications are silent on, because to have the body that you want, you're going to have to, do things to build muscle. I mean, that's what gives you the sculpted look that you would want for most people.
Well, plus we know as we age, especially women, we've got to be in the gym pumping iron. I mean, we have to be for our testosterone, a lot of things. The one thing I'm concerned about as a layperson in this whole semaglutide, because as a health coach, people come to me all the time. Lisa, I can get this and da-da-da. And it's their choice. I obviously don't give medical advice. I just have them walk with them through it. But Dr. Fung says, and this is one of I have a lot of things that I quote from him, but one of my favorites is that we're hormonally wired to eat and to stop eating. And so if the semaglutide or Ozempic doesn't cure the leptin resistance, and he talks about the cholecystokinin and the peptide YY and these other satiety hormones that are part of our brain, that tell us you're full, then I don't know. I think it's going to be the fen-phen of 2022 or 2023, which fen-phen was a big bust.
And speaking about fen-phen, I mean, a lot of people go on these drugs without really understanding the possible side effects. So there's a possible side effect of pancreatitis.
Shoot.
You're not supposed to give it to people who have a family history of endocrine cancers, for instance. Oh. Why is that? And so there are, a lot of things about these drugs that people don't know and maybe is or is not disclosed to them at the time that they get it. The way the drug also works, one of the ways it works is it actually slows down. It effectively gives you kind of a gastroparesis where your stomach doesn't go forward.
Oh, like motility almost?
Right, because that's how you feel full and nauseated.
Oh.
So, there's many, many sides to these drugs that I think people don't think about when they're just like, oh, well, I've seen my friend take this drug and they've lost all this weight. My thing would be, have you seen your friend naked?
Right.
And,
that's good.
Have you thought about these drugs?
That's an odd question to ask somebody, but you do you. I have 3 or 4 friends with gastroparesis because to me, I mean, it got to be all of a sudden I started seeing more people with it. Coincidentally, they had their gallbladders removed and maybe a vagus nerve was clipped, I don't know. But you talk to someone with gastroparesis, they will tell you, run as fast as you can to not have symptoms. Their fullness is so uncomfortable, they say, and the nausea, and they vomit too. And so, but I've heard, now that you're saying it, Ozempic and those drugs do have a nausea vomiting side effect, right?
Yeah. I mean, the gastroparesis isn't permanent. It stops when you stop the drug.
Oh, okay.
Right?
Okay. But still, just that feeling.
Right. Yeah. It's not pleasant.
Yeah. It's what we do for beauty. I mean, we all say that and, we're living it. So what do you do every day then to maintain your svelte figure and your 6-pack abs?
So I do a few things. One is that I do a strength workout, 90 minutes, 3 to 4 days a week.
That's a lot.
Yeah, but for me, that's what I love to do. I love to have that sculpted figure, and it's not something that comes naturally to me. I have the ACTN3 gene, which makes it very hard to build muscle. I have ACE-DD, which makes it easy to build muscle. So I have the two kind of fighting each other.
And how did you find these things out?
So I do neutro-genomic testing on everyone that I help with weight loss. And that is one of the things, I actually match up their labs, their neutro-genomics, and try to figure out what's going on. So if their estrogen is high, I'm not just going to say, well, I'm just going to give you something to lower estrogen. I'm going to look at, is your estrogen high because you're intaking a lot of xenoestrogens from the environment? Is it high because you have the COMT gene and you don't have a cellular way of clearing estrogen? Or is it high because your liver enzymes, your CYP, CA12, and your A17.
Okay, you're just showing off now. I'm totally lost on A's and B's and C.
Yeah, so these are all liver enzymes that
Okay.
have different genetic, what we call alleles or different genetic components for different people. So some people's enzymes work really well and clear estrogen quick, and other people's don't really clear estrogen at all. And so, but why you're not clearing estrogen or why your estrogen is high really has a lot to do with how successful we are in bringing your estrogen down. Depending on what treatment we're using. So we can give you all the liver clearance in the world, but if your problem is COMT and your liver is actually clearing estrogen, that's really not going to help you.
So you knew these things in order for you to go to the gym to know what was best for you, even at the gym.
Even at the gym, even when it came to food. For instance, if you have COMT is an enzyme carboxy-O-methyltransferase. It clears your fight or flight hormones, estrogen, cortisol, and is a general detoxification enzyme in your cells. Now, there's 3 kinds of variants of this. There's the people that have the fast, people that have the slow, and then people that have 1 gene of each that are kind of in between. The in-betweens are actually best because they can clear things, but they don't clear dopamine really quickly. Those of us who are super clear dopamine very quickly. So when you clear dopamine really quickly, what happens is you actually are more tempted. You're more likely to be like a person who gambles, a person who eats out of turn, a person who craves alcohol, drugs, etc. So the fast COMT people, that's really more their problem when it comes to weight. They're clearing their estrogens and their cortisol fine, but it's that other issue that they have. The people in the middle clear some estrogen, clear some cortisol, but they also don't get rid of dopamine really quickly, so they're actually best off. And then there's the slow, which are having lots of cortisol hang around, lots of fight or flight hormones hang around. They're very anxious, and they don't get rid of estrogen. So, knowing these 3 types is really important because it also has a lot to do with which B vitamins you will do well with. Like if you're a slow COMT, you can over-methylate and actually get more anxious. You can over-methylate the enzyme. There's things that slow down this enzyme, like green tea is super for me with the super fast COMT enzyme. But if you have a slow COMT enzyme, it'll slow down your enzyme even more and make you anxious.
Oh, my word.
Right. So what you should eat and drink and do for your exercise, all genetic.
All genetic. So do you have siblings?
I do.
Do they similar in, what they've battled or maybe their weight issues or things?
Yeah, some similarities. I mean, we had really different upbringing. So, when I was little, they kind of gave people like grains really early. And with my 2 youngest sisters, my mom was already a nutritionist and she'd read this old nutritionist, Adele Davis, who I think was like psychic or had traveled to the future because all of her recommendations were so amazing. But she was like, don't give kids grains before they're 1. And my 2 younger sisters have never had the same like kind of weight issues as we did. And I think that was kind of the difference for them. But, the 3 oldest ones of us have. My sister in the middle, not as much. She was like always a yoga instructor and stuff, but she was a gym rat. And I remember telling her, like, I'm ACD and you probably are too. You should quit lifting. And sure enough, she started looking like Arnold Schwarzenegger. And she had to like cut back on her weights. And then when I tested her, like, yeah, she was the ACD. So it's really, they're not everything because there's always environmental factors. And that's why we check your hormones and all your regular labs and your gut health and all of that and put it together with your genetics. But a lot of this stuff is genetically determined, and even whether or not intermittent fasting is going to be a good idea for you or not is genetic. So
that's really interesting because I do once in a while, and it baffles me, and now I know what I can do. I can have them come talk to you, is the person that says, Lisa, but I've been fasting and it's just not working, or it's not a good fit for me, or just some other things. And I don't know what to say or do after that. Because the one thing that life has taught me as I've aged is I don't judge people because I've not walked in their shoes. I don't think when I see someone overweight, well, lazy, or you need to work out. No, some of the heaviest people I know work out all the time. They do all the right things, but something's not working, so I've never understood. So you're just saying DNA has so much to do with it.
Yeah, I mean, the drug companies are getting into the act. They've gotten wise to this because there are leptin receptor gene defects that they now have a medication for. They actually came to my office and they're like, "Do you know anything about neutro-genomics?" I'm like, "Well, I've only been teaching it to other docs for 10 years." Yeah. And they're like,
So kind of,
"Are you,
yeah. Yeah.
are you aware of the leptin receptors genes?" And I'm like, "Yes." And of course, I've been using like all these natural things, but now they actually have a drug for it. So yeah, I mean, people.
But how are they going to find out, though? They're not going to, they want to sell the drug. They don't care if you get tested or not. So they're just going to give you the drug without getting tested.
No, so they'll pay for your test now because your insurance companies will only cover it if you find this gene, but they're only testing for leptin. They're not testing for like all the other stuff, like what exercise you should do or should
No,
do.
but that's a huge one. I mean, literally, it can be because it can be the genesis of a lot of people's problems. That's why Dr. Fung, it goes back to we're hormonally wired to eat and to stop eating.
Yes.
And if you're that's the one thing that I can say that intermittent fasting has done for me. My satiety hormones work beautifully. That I'll be in the middle of a meal thinking this is so good, and I put my fork down and I go, I'm done. Like,
It's gonna have to wait till tomorrow.
it's gonna have to wait till tomorrow, and
Yeah.
whether it's a cocktail or a dessert, I really can't eat anymore.
And see, I never had that feeling until I had my insulin resistance under control. The first time I was able to put down my fork, I was like, oh my gosh, this is not me. Like,
Yeah.
I can actually put down my fork. So before I had to just pile, things that I could eat on my plate to try to keep to 1,200 calories. But now, I don't have to do that. But yeah, I totally relate to that. And, it's amazing that intermittent fasting has worked for you because that's awesome.
Yeah, but not for everybody. I understand. Now,
But I had a patient the other day who basically told me like she intermittently fasts 3 days at a time, and she's 100 pounds overweight like I was. So, it's not the panacea for everyone, but for 85% of people, it's actually genetically a good idea to intermittently fast.
Yeah.
About 82 to 85% of people.
right. Well, our ancestors weren't dining 6 times a day.
That's true.
And one of and you might not have even heard of this one. So all of my autoimmune conditions that I've reversed all of them. My vitiligo I'm working on, but that's cosmetic. It doesn't, it doesn't bother me. But there's this rare one that I have called achalasia. It's a motility disorder as well.
Yeah,
and
absolutely.
Okay, well, sometimes doctors will go, no, I've never heard of that one. Go to your GI doc for that. But I say all this because so I've had it for about 20 years now. He's now taking me off the achalasia. I'm not in the sorority anymore. He said, you don't even have it because he did another test to see motility and stuff. But in the very beginning, when I started improving, I'd been intermittent fasting then for about 3 years, and I was going back because I'd have to have an upper GI like every year or two. And he told me he's an advanced clinician. He said, you have the best achalasia case I've ever seen. And I said, why do you think that is? And he was not in the fan club for intermittent fasting. He didn't know much about it. He said, all I can think of is that your fasting has given your digestion a break. And he said this, and I've never forgotten it. He said, we were like this. We were never designed to digest all day. He goes, our esophagus was never, and so mine is more of an esophageal thing, as you know, as you understand, but other people going, what's going on? My food would get stuck and my lower esophageal sphincter didn't open because it has to relax for the food to go through. So it kind of is a first cousin of gastroparesis, but it's not as bad. Like, it's not as uncomfortable. But now that I've reversed it, I really do think, for me, that's why for me it's worked so well, is that my body works better if I just eat in whatever the hours are for that day. Maybe 4 hours, maybe 2 hours, maybe, what I do for me is go by my satiety hormones. When I'm full, then the fork goes down.
What I think is so impressive, though, Lisa, is achalasia is actually associated with some pretty scary autoimmune conditions. So if you reverse that, I mean, that is amazing. They're some of the hardest ones to reverse. So.
He said scleroderma is one of them. There's some other things, right? So he told me this summer, and the interesting thing about him is my husband works in the GI field he was a rep. He's now vice president for Olympus, the camera company. And they're in there doing upper GIs and colonoscopies all day, every day. So
Absolutely.
we've gotten to know this physician, and he said he came and had dinner with us, and then sometime later he did the upper GI and the colonoscopy. He said the reason I redid the manometry on you, which is this horrible test they have to do where they put a tube through your nose and measure the pressure as you swallow, and it is not comfortable, right? But he said the reason he redid it, because he said, when I had dinner with you, I noticed you didn't struggle. He said, he goes, I thought, she's not a typical achalasia patient. And I've been his patient for about 8 or 10 years. I've had it for 20 something. And he goes, I'm just going to test you again. And that's when he said, you don't fall under the clinical definition anymore for the diagnosis. And he just said, good on you. He said, I don't ever see that, but good on you. So that's where I do attribute intermittent fasting. I say it changed my life.
Absolutely. Yeah.
Because achalasia, when I was in the throes of it, it was uncomfortable. I mean, and this isn't about me, so it doesn't matter, but that's how fasting has changed my life. So those are some of the benefits of it, but I understand that it's very possible it wouldn't work for everybody.
That's amazing. I mean, it's one of the hardest, immune conditions to reverse. So that's just.
Is it? He said, I hope they do a story on me. I hope hope People magazine comes and I'll have a blowout that day. It's because I do love to champion things like that, to tell people this. You can revert. Now, not all things, and I'm not making a blanket statement, but that's why I'm working so hard now eating carnivore, because there's some, and I don't know if it's scientific or not, it may be anecdotal, people are saying they've repigmented their skin through eating a meat-based diet. We'll see. Again, it's superficial. It's cosmetic. It doesn't matter. But I'm like, while I'm up and I'm reversing all these others, I'll try to reverse that.
Yeah, I'd love to know how that works for you.
On your social media, some other things that you talk about, I'm in love with magnesium now. Magnesium is something else that I have incorporated in my diet and in my life, and I sleep better at night. I poop when I need to, I relax when I can. Tell me, why aren't we talking more about magnesium? I know you do on your socials, but why aren't more people talking about this?
I mean, we're not educated about these things really in medical school as much. We're only, we're taught about magnesium for a really scary arrhythmia called torsades, where we push it when someone, dies of this particular arrhythmia from low magnesium, but we're not really taught about it in the daily, and I remember seeing so many people now back when I was training that had muscle spasms, headaches, sugar cravings, etc., and had all of these things in one person. And I think, they were low on magnesium, and like 80% of Americans are actually low in magnesium. It's not in most of our water supplies. Because we have to filter our water, actually, we're removing more magnesium when we do that. So it is really kind of an important thing. And what a lot of people don't understand also is that there's all these different kinds of magnesium that do different things. So, if you're taking magnesium citrate or magnesium oxide thinking you're going to absorb a lot of it, you're not. That's really more for constipation or kidney stones. Whereas, if you're taking magnesium glycinate or malleate, that's more for your muscles or for basically like your mood and relaxation and sleep. And same with magnesium L-threonate. Magnesium L-threonate is just kind of a more robust form like the magnesium malate and glycinate that gets absorbed, but it absorbs even more, and it even crosses the blood-brain barrier more and actually gets into muscles more. So I kind of step grade that because malate and glycinate are pretty affordable and L-threonate's kind of expensive. So I usually try the first. And genetically, there's some people that actually do better on the malate and glycinate. I have a friend who has MS and she could only sleep on that. The L-threonate didn't really work for her. So everyone's a little bit different, but those are the three that really work more if you're trying to relax more, sleep more, get your muscles to relax, get rid of those tension type bands across your head, all that kind of thing. Those three types of magnesium are the ones that you want to look for.
Now, I'm a Bioptimizers fan, and so that one has 7 different types of magnesium, but it doesn't have threonate. So do you think it's important, Are you saying that everyone does need a 3 and 8?
No, I'm saying 3 and 8 is reserved for people that have like really serious issues with their mood or can't sleep at all on like the more affordable magnesiums. So I usually start with glycinate and malleate chelate for most people because it's very affordable.
Okay.
Like you can get a 6-month supply for, I don't know, $40 or something. And then I move to the 3 and 8, which is probably $40 a month, if like the cheaper one doesn't really work. So,
Okay.
yeah, that's my
So in the supplement pile, if someone doesn't do the genetic testing, well, let's say we all need magnesium.
Mm-hmm.
Now, there are other things we're missing from our diets because they're low in potassium, salt, just typical electrolytes.
And it's interesting because it's been shown that iodized salt actually causes more thyroid problems than it solves.
I know.
I was just reading a review about this from 2 endocrinologists in Greece that had looked at this. And I think the reason for that is because your thyroid doesn't like to get like inundated with a bunch of iodine. It likes to slowly get iodine. So when I replete iodine in people, I actually give them kelp because it's a slow release form of iodine.
Okay.
And so I'm not a big fan of people using iodized salt because, like I said, the studies show that's actually bad.
Yeah.
And I've seen health practitioners say like, yeah, just take iodized salt and you won't have iodine deficiency. And it's like, well, maybe you won't have iodine deficiency, but the studies show that you're actually going to suppress thyroid hormone production more. So that slow release kind of iodine from kelp, I found in my practice works a lot better. Most people are really deficient in vitamin D3, and they have to take that with K2 because K2 actually makes sure that vitamin D gets utilized properly in your body, that it doesn't cause bone spurs and extra calcium, but the calcium, and doesn't have calcium go in your arteries. It takes the calcium to your bones. So I think those are the main ones. B vitamins are tricky because B12 and folate, you actually need to know your genetics to know what kind will work for you.
Right.
Whether you have MTHFR or MTRR, which would mean you would need methyl, or on top of that, if you have COMT, you're going to need like the hydroxyl or adenylyl form because you can over-methylate and make yourself more anxious. So, that's where knowing the genetics is really important, is in those 2 vitamins, B12 and folate. And then how much of vitamins you need is kind of genetically determined too. So some people need more vitamin D because they have vitamin D receptor defects, or some people have trouble converting vitamin D25OH to the 125 form, etc. So when I do genetic testing, I know about all that. So I know like, okay, you have the vitamin D receptor, so you really need to run your vitamin D at a certain level versus somebody who doesn't.
Fascinating, all this information that you have. I wish, every doctor were like you. That we had people who were educated on not just with a prescription pad, but more of, let's tweak that. You're living it. You were probably a victim of the, Western medicine philosophy, and there you were overweight. And
overweight with a kid rolling on the floor screaming.
Okay,
so
that's
my
enough.
life was vastly different.
Right. And you feel great, and you look great. Your hair shiny, and all the things that mean good health. So, good health works. And I see you do have some sunshine there. That's my big thing.
It's an unusual day in Seattle.
Okay. Yeah, I was going to say. So you're so far north, you probably don't get any vitamin D at all from the sun because of the Earth's axis and northern hemisphere, right?
Yeah, most of us around here are pretty low on vitamin D, even people who work outside. So our sun is not that strong. And then, a lot of people don't have vitamin D precursors, so they're like, well, I'm in the sun all the time. And I'm like, well, unless you're eating fatty fish, you're not going to have a lot of the or seaweed. You're not going to have a lot of the precursors. So that's the other thing people don't know, is it's not just the sun conversion. You have to have a precursor. So
what is your vitamin D level living so far north?
So I take a lot of vitamin D. I take about 5,000 units a day, and I used to take more. When I initially checked my vitamin D level, when I first started doing nutrition, it was like 17, and now it's, 60.
Oh my gosh. Yeah.
Yeah.
I think I'm at 55 now. I work hard. And some of that too, I have 2 redheaded children, with one's blue-eyed, one's green-eyed, and theirs is higher than mine with my green eyes, black hair. So
Yeah.
Coloring has something to do with that too, right?
Definitely does. Yeah. So those of us who, came from areas where the sun was strong, I mean, we have, basically melanin that protects us.
Yeah.
But it also does not allow us to get as much vitamin D.
Yeah. Isn't that interesting?
Well, the trade-off was, for those of us who are Mediterranean anyway, we were eating a lot of fatty fish. So we don't do that anymore.
That's interesting. That is so, I got to think about that. Okay. I love to think about these things. Great job today. I'll post, of course, all the things people need to know about you in the show notes, but you are a treasure to people who see you and people who get to see your social media. So Dr.Emi, E-M-I, is her Instagram account, but I'll put all that. Thank you so much. Thanks for listening to the Lisa Fisher Said podcast. Be sure to hit subscribe and download all the episodes and leave a review, won't you? The Lisa Fisher Said podcast is produced by ClantonCreative.com.